The other issue which we considered as cabinet was the issue of COVID-19. The Minister of Health presented a paper touching on the upsurge in the COVID-19 cases, availability of vaccines, but also the issue of vaccinating children, which has been dominating public discussion. One, we noted that there is a rise in the number of COVID-19 cases since the last week of May this year. I hope you know, as the media practitioners, that we are seeing a rise in the cases of COVID-19. The average number of cases have increased from 20 cases per week between January and May to now over 600 cases per week in the month of June. And that is alarming, because we opened the public space at the beginning of the year. The positivity rates were down, the number of cases were few, and we're saying from January to May we were registering in the country about 20 cases per week. But in the month of June, we have now seen cases increasing to about 600 cases per week in June. The positivity rate, as we reported earlier on, had dropped to below 1%. Positivity rate means if we test all of you, how many of you test positive? That rate had dropped to less than 1% in the population, but now it has raised to 3.5%. And this might mark the beginning of the first wave. You know, we have had 3 waves. So we are worried that this, unless we take remedial action as Ugandans, this might move into another wave, and we must take caution. And the laboratory examinations are indicating that it is still Omicron variant that is responsible for this upsurge. You recall last year when we had a deadly wave, it was occasioned by Delta variant, when we lost very many people in the country. Then the preceding wave was Omicron. So even this one, the laboratory tests which are being done indicate that it's still Omicron, so there hasn't been a change in terms of the variant. But just to comfort you, because when you mention this, people start saying, oh, they are going to lock down again, shut down the public spaces. No, we are not saying that we would want to go into lockdown, but we just have to take extra precaution as Ugandans, because there has been complacency also. There has been complacency. When the positivity rates came down, people relaxed and behaved as if COVID-19 had completely gone away, and yet it is still lingering around. It is still part of the problems that we have. Time and again, we've been urging Ugandans to please come up for vaccination. I don't know whether all of you are vaccinated, you who are covering this media event. There is being vaccinated, but there is also having completed the vaccination. There is having completed the vaccination cycle, but there is also having got a booster. So where are you? Yeah? One of the 3. Now let me show you some statistics. Since the vaccines became available in this country, we have administered 21,634,800 vaccine doses. in the country. And of these, 71% are those who received the first dose, which is 16.1 million doses. That is 16,136,413, those who have received the first dose. Now, those who have received 2 doses, the number now drops to 5,417,599. Those who have received a booster dose are only 80,788 doses which have been given. So that means when the drive to go for vaccination started, many people responded by getting the first dose. But a big number has not yet received the second dose, and very few have received a booster dose. And therefore, our appeal to the public, to Ugandans out there, is that let's not behave as if COVID-19 has gone away. It is still here with us. And the answer to COVID-19, one is to observe the SOPs, as we have always guided, but most importantly, to get vaccinated. And the vaccines are available here in Kampala and in the countryside in all the districts. But it's also important, even when we have done a lot of mobilization led by the Ministry of Health, that about 65 districts are below 50% coverage for full vaccination, even when we had 2 rounds of campaigns. So as the COVID-19 cases went down, people became complacent and abandoned vaccination. And maybe that's why you see an upsurge in COVID-19, because the population is not taking heed of the advice by the medical people that for us to defeat this COVID-19, we must vaccinate. And therefore, we are renewing that effort of urging Ugandans to please turn up for vaccination. If you have not received any vaccine, go for the first dose. If you received only 1 dose, go for the second dose, unless if it was Johnson & Johnson, because for it, 1 dose is complete. And if you have completed the dose, either by getting 2 injections or 1 if it is Johnson & Johnson, please go for a booster. We are even encouraging those who got the 3rd dose, the booster, to go for a second booster, because the protection given by this vaccine is not everlasting. It wanes after 6-8 months. That's why we encourage you to take a booster. Now, because there has been that complacency, vaccines have begun to expire. And yet, you know, the struggle we went through to get vaccines. At one point, the challenge was, how do we get vaccines into the country? Now the vaccines came, now we are not uptaking these vaccines. And so far, 2.5 million doses have expired, doses of this COVID-19 vaccine. And we have 6 million doses, 6,123,408 doses, which are at the risk of expiry if we do not use by September this year. But we have enough vaccines in stock, but also expecting more deliveries of vaccines. So we would want to urge you, the media practitioners, to join us in the government to appeal to the public that people should come for vaccination if we are going to defeat this challenge of COVID-19, if we are going to avoid lockdowns like we had in the previous periods. Let us embrace vaccination and make sure that we are protected. Personally, I have had the first 2 doses. I have got a booster, the third one. I am now going for a second booster, which will be the 4th dose. So if I had time, I would ask each one of you how many doses you have had. And as we have been saying, that this vaccine protects you against severe infection. Even if you get infected with COVID, it won't be severe. It protects you against hospitalization. It protects you against death. And you know, people have died because of COVID-19 here in Uganda. So it's not something foreign, it's something which we have witnessed here. So Cabinet, in our meeting, we agreed to renew the efforts of mobilizing Ugandans to come up for vaccination and also observe the SOPs. When you go in the countryside, people have abandoned putting on masks, washing hands, social and physical distancing, as if COVID-19 is no more. So we would want to appeal to Ugandans, let's continue observing those measures and also take the COVID-19 vaccine in order for us to defeat this problem of coronavirus. Lastly, on COVID, we also discussed the issue of vaccinating children, and we agreed that we go ahead to have children vaccinated, and particularly we shall start with children between the ages of 12 and 17 years using Pfizer. And as earlier communicated, we guide that the parents should give consent for their children to be immunized. There are people who spread a lot of fears in the public about the safety of this COVID vaccine. We would like to reassure the public that these vaccines are safe and efficacious. Efficacious means effective. They are able to protect you, and they are safe. They are not harmful because they went through the procedure, the trials which are done before they are allowed to be used on human beings were satisfactory. And we are scientists. We have reviewed all those processes. There is no reason whatsoever for anybody to get worried about these vaccines, even among children. But there was this presidential, former president candidate, Kaboreta, who was saying, this vaccine causes impotence and so forth. That's not true. First of all, we have operations research, where we are following up all those who are receiving the vaccine. And we do not have any worrying effects at all among those who have received the vaccine. And we corroborate our observations with international partners, because not only Uganda, which is vaccinating, but all countries world over are vaccinating their people using the COVID-19 vaccine. And therefore it's so true. You should not listen to those naysayers, to those people who are just opposed for the sake of opposing the vaccine, because we are guided by World Health Organization, and there is no reason whatsoever for anybody to doubt the safety of the vaccine, both in adults but also among the children, because we have since established COVID-19 also affects children. We have seen children die of COVID-19, and therefore any efforts to protect our children should be welcomed by all Ugandans. You should not fear. The effort is to protect all of us, adults and children alike. We understand the science of the vaccine, and those who are peddling falsehoods regarding safety should just be ignored and held in contempt, because if there was anything to worry about the COVID-19 vaccine, then we wouldn't allow Ugandans to be vaccinated. Even ourselves, we will not allow to be vaccinated. So there is no reason whatsoever. So we want to urge Ugandans to embrace vaccination, to religiously follow SOPs, so that we can completely defeat this pandemic of COVID-19.